Yes.
Long wait lists for competency examinations and restoration services means some defendants with mental health issues may actually be released from jail before they get the services they need.
KCBD News Channel 11's investigative reporter Shaylee Kidwell has this update in tonight's mental health crisis report. Shaylee?
Karen and Abner, we've learned a shortage of doctors qualified to conduct competency evaluations is contributing to the problem. But that's not the only wait list some defendants face. What happens when a jail becomes the largest mental health provider in the county? In Lubbock, Sheriff Kelly Rose says it already has.
Unfortunately, in the United States, our jails have become our de facto mental institutions. You know, once we moved away as a nation from the inpatient care model to the outpatient care model, that's where these individuals are ultimately landing. Rose
says 50% of inmates at the Lubbock County Detention Center have a history of receiving mental health services.
Cut that number about in half to 25 to 26% of those require treatment while we've got them.
The detention center has a contract with StarCare, the state-designated local authority for mental health and intellectual disabilities in Lubbock.
And they manage all of our mental health issues and individuals.
Rose says those with mental health disorders often stay in jail longer, which costs taxpayers more.
In terms of getting them processed, determining, if competency is going to be an issue, you're literally pushing people into years of time spent in the jail.
Rose says one inmate who required mental health and medical services stayed in the Lubbock County Detention Center for more than 2 years, racking up hefty bills.
755 days later, that's what the taxpayers of Lubbock paid for one guy, and he's not the exception.
Rose says the inmate was ultimately deemed incompetent to stand trial, and the case was dismissed.
I had the staff go back and get with the hospital to calculate what kind of costs were associated with his stays, and it was just under $1 million for one guy.
StarCare's Director of Forensic Mental Health, Dr. Sarah Kim, says one of the challenges is a wait list for competency evaluations.
We have a severe shortage in forensic psychiatrists, psychologists to do competency evaluations. Our courts contract privately with these doctors to provide them, and they're so backed up because there's just not many of them.
Dr. Nancy Trevino is the director of the Texas Tech Mental Health Initiative. She says this shortage not only means more time, but it also means more money.
So we're having people, providers that are able to really set their own price. So the evaluation can be anywhere from $700 to $1,200 for one evaluation. In statute, there's a certain time period in which they need to submit their report, but there's such a shortage, such a critical shortage, that sometimes there's some challenges meeting that deadline as well.
Marlise Boyles has handled the competency docket in Lubbock County for about 6 years. She says the competency evaluation wait list presents problems. But Lubbock is lucky because the Lubbock County Detention Center, with the help of StarCare, offers restoration services for defendants found incompetent but restorable.
Which is wonderful. That enables the defense attorneys to still meet with their clients during the restoration process. We're not having to pay transport. We're not also having to wait, on that state hospital wait list for them to undergo restoration, because it's not just Lubbock County that's sending them to the state hospital. It's also every other county here in Texas.
But Rose says not every defendant qualifies for jail-based restoration services.
But if an individual's got more serious charges, typically something that's aggravated, and those levels, the state says no, that can't be worked through with jail-based competency. They have to use the state hospital system.
According to StarCare, right now, the wait list for admission to a non-maximum security unit is 121 days. The average wait list for admission to a maximum security unit is 140 days. State law limits how long defendants can sit in jail awaiting trial, and long wait lists mean some defendants who suffer from a serious mental illness may walk free before ever seeing a psychiatrist.
With the amount of defendants that we have coming into the jail, there are some, because of different deadlines and timelines, that they are going to time out on their charge before we can even address competency.
Boyle says the DA's office has limited options.
We can only work with the laws that we're given, and so it's either file a case and proceed with a criminal case, which we can't do, or we have to reject the case and dismiss the case, and then we're back at square one with, certain people coming in frequently.
Rusty Gunter, the chief defender for the Lubbock Private Defender's Office, says as the population continues to increase in Lubbock, so do the caseloads.
Our mental health attorneys are getting them daily. I think our caseworkers are rolling about 60 to 65 active cases.
The New Mexico justice system experienced similar challenges. So in 2024, the state launched a competency diversion pilot program. It allows qualifying nonviolent offenders the chance to have their charges dropped if they complete mental health treatment. New Mexico Supreme Court Justice Brianna Zamora says they refer to this as leveraged treatment because the defendant has a choice.
You can go through the criminal justice system and face its consequences, whatever it may be, and it may be dismissal, but you still have to go through everything in between, or you can get treatment and your case will be dismissed.
So could something like this work in Lubbock County? We asked these attorneys and other stakeholders. We also spoke with Texas Tech about its efforts to grow the pipeline of forensic psychiatrists and psychologists and keep them right here in Lubbock. We'll have more on these angles as we continue to investigate the mental health crisis. Karen and Abner.
Thank you, Shaylee.